This is a case of LV lead implantation in a patient with CS Atresia, where the lead was implanted via a persistent vein of Marshall performed by Dr. Steen in Oslow, Norway, utilizing interventional techniques. The CS could not be located on 2 previous attempts at LV lead placement at other institutions. They started off with coronary angiography to visualize the CS on leva phase, and you can see here, here's the coronary sinus, and you can see that the coronary sinus is emptying into an atrial chamber. We have this structure here, which turns out to be a persistent vein of Marshall, and then we have the area of the Vueson's valve, and then above that, branches coming off, and a branch coming off down here. So recognizing that there was a connection to the left subclavian, a wire was advanced into a vein off the innominate subclavian that initially did not reach the CS. In retrospect, this was probably a pericardiophrenik vein. Utilizing an IC90 from Biotronic, they were able to engage another venous structure off the subclavian, and this time the wire was advanced and went down into the coronary sinus, and you can see here out into what looks like the lung, which ultimately turns out to be the pulmonary vein. See different views here. And so here's contrast injection via catheter advanced down the wire. And again, it can be confusing as to whether this was in the right atrium or the left atrium, but confirm that it was not possible to snare the wire in the right atrium, confirming it to be in the left atrium. And in addition, this could have been checked using saturations. So a balloon was advanced down the persistent vein of Marshall, a venogram performed, and now you can see the structures, which include, here would be Vueson's valve, here's a posterolateral branch, here's the vein of Marshall above that point, and so it was then possible to advance the pacing lead down into the target vein, now it's important to provide enough slack in the lead so that when the patient takes a deep breath, it doesn't pull the lead out, which is a little bit tricky. So you want to make sure this has as much slack in it as possible, and put a little in the bend down there as well.